Doctor?
Thank you for introduction. Sarcopenia is characterized as a progression or generalized loss of skeletal muscle mass and strength with or without increased fat mass. And sarcopenic obesity means a high visceral adipose tissue to skeletal muscle ratio. Postoperative pancreatic fistula is the most serious complication after pancreaticoduodenectomy. In previous study presented that sarcopenic obesity is a strong predictor of a major complication after pancreaticoduodenectomy. The purpose of this study is to define sarcopenic obesity by automatic calculating program using preoperative CT scans and to evaluate the effect of a preoperative sarcopenic obesity on POPF following pancreaticoduodenectomy. Between January 2007 and June 2016, the preoperative CT images of patients were analyzed. Total 548 pancreas head cancer patients were included. The visceral adipose tissue to skeletal muscle ratio was calculated from preoperative CT images at the third lumbar level. The standard of sarcopenia as a well-known value was used. Sarcopenic obesity were extracted cutoff values from the RC curve. POPF was classified according to ISGPF 2016. The patient in sarcopenic obesity group were statistically significantly older, had more body weight and higher BMI, and heart disease rate was higher in patients with sarcopenic obesity. ASA score 3-4 distribution also showed a high proportion of patients with sarcopenic obesity. The pancreatic duct diameter was significantly smaller in sarcopenic obesity group than non-sarcopenic obesity group, and the EBL was significantly higher. The occurrence of CRPOPF was significantly higher in the sarcopenic obesity group. The mortality rate within 30 days after surgery was also higher in sarcopenic obesity group, but the statistical significance was insufficient. Body weight, BMI, and cardiovascular disease were not a risk factor of CRPOPF in multivariate analysis. In univariate analysis, CA99, portal vein invasion, pancreatic duct diameter smaller than 4 mm, visceral obesity, and sarcopenic obesity were statistically significant with CRPOPF. After multivariate analysis, the presence of sarcopenic obesity was the only independent risk factor for developing CRPOPF. In survival curve, 5 years survival rate between in sarcopenic obesity and non-sarcopenic obesity group, there was no statistical significance. Sarcopenic obesity derived from preoperative CT scans is only independent risk factor for CRPOPF after pancreaticoduodenectomy in patients with pancreas head cancer after multivariate analysis. And preoperative sarcopenic obesity measures may stratify patients into risk categories for predicting CRPOPF. For the evaluation of effect with sarcopenic obesity to survivor after pancreaticoduodenectomy, more observational study will be needed. Thank you for your attention.
Thank you very much. There are some question, comment. The morbidity of the operation in this patient is for your morbidity of the obesity or for the pancreatic fistula. What is your opinion? All patients with obesity are more risk. Or what is the difference?
In sarcopenic obesity, it means decrease the muscle mass and more fat mass. It's not only mean the fat obesity meaning. So higher BMI is different from sarcopenia or sarcopenic obesity because in higher BMI patients, some patients have more muscle mass and small fat mass. It's not a sarcopenia or sarcopenic obesity because so I think BMI is a little bit more sarcopenia or sarcopenic obesity is more important thing than BMI, I think.
Okay, thank you very much.